Late this afternoon, I spoke again with the Southern DHB CEO, Chris Fleming, who does front. He does make himself available. We've already run some of that interview talking about what does appear to be a real crisis in the urology department. We ran that at the top of the program. It is now available online. Chris Fleming reiterated, as he did last week, that it wasn't unusual for the hospital to be running at capacity during winter and that it was recruiting and investing to increase its ICU capacity from its current maximum of 8 beds, 10 by next August. I asked him if the hospital still had the fallback position of sending patients to Mercy when they needed to.
We do indeed use Mercy Hospital for elective activity across the year as our capacity allows. And indeed, we use Mercy Hospital at times for cardiac cases, as we've already talked about.
Right, so you've been full. There are particular demands on you over winter, and you have Mercy as a fallback position, but you haven't used Mercy at all since June 30th. Why not? We need to make sure we are not mixing the two issues up. We've been doing production planning for the year in terms of making sure that we are able to deliver our elective targets in excess of 13,000 procedures across the year, and we have plans in place. Those plans do require us to use some elective capacity outside of our facilities, and we will use them. Chris, I'm so sorry, I don't understand that answer.
Sorry?
So you've just told me the hospital has been full. We've been told, and the people who've been talking to us call it a code black. I think you call it access block,
yes.
where you don't have a bed. We've talked repeatedly, and you were very upfront about an insufficient number of ICU beds. We've talked about Mercy as a fallback position. You have not used Mercy since June 30.
We haven't used Mercy since June 30, but as we've talked about in terms of cardiac cases, we do assess the patients relative to what is appropriate to be able to be provided at Mercy.
Chris, this is about money, isn't it? You just don't have enough money.
No, it's not about...
And you have just announced a deficit reduction down substantially to 11.5 million, which I'm sure satisfies KPIs. You also are operating under a commissioner appointed by the Health Minister, Jonathan Coleman, in June 2015, who was sent in when the board was sacked with the intention of reducing the deficit. You don't. And this must be a terrible position for you, but you don't have enough money, do you?
Look, I would never say no to more funding, because health can always use more resources. But we have had funding increases, and we are delivering more work across Southern DHB than we ever have.
That's numerically, isn't it? So you're doing more operations. But
we're doing more operations, we're getting more presentations.
Absolutely, but you and I both know, and I'm sorry to interrupt, but this is an important point of clarification. You and I both know that substantively, the numbers that you are relying upon there to say that you are doing more operations are at the more minor end of the scale, and the stresses and strains and cancellations and frustrations are about more serious operations.
But the cancellations about the more serious operations have largely been attributable to failure to invest in the appropriate infrastructure over many years. More money will not solve it. We are investing in redeveloping the ICU, and as I've mentioned earlier, previously, we've invested in more ICU doctors, nurses, resources for the unit. We cannot physically develop the capacity faster, but we are considering a plan about flexing how we're using our capacity. We're going to be looking at increasing the ICU bed numbers, as I talked about in previous interview.
Yes.
And the plan also says how we will use both inter-district flows in terms of other hospitals across DHBs and also the private capacity.
Is there anything you'd like to say to the Minister, who we are desperately trying to talk to? Because I have a sneaking suspicion you are absolutely stuck between a rock and a hard place. Is there anything you would like to say to the Minister or the Ministry or Treasury about the KPIs that are driving you, the pressure on you to reduce your deficit? Would you like some of the pressure to be eased off? Would you like to be able to spend more money on medicine?
Well, look, I'm really pleased about how we're working with the Ministry and the Minister at the moment around getting to the point of making decisions about a sustainable future investment in our facilities. And I would never say no to more resources, but every DHB around the country would be quite happy with more resources, but we're getting more funding put in year on year. And it is our job to deliver in a prioritised way. We should be in a better position with the state of our facilities than we are in, and we are all working together to resolve it as quickly as we can.
It's Chris Fleming, the CEO of Southern DHB.